Welcome back to CGTN. Liverpool was the first city in England to be placed under the country's highest Tier 3 restrictions on October the 14th. And now the government will use it as a pilot scheme there to regularly test its population.
From Friday, new rapid turnaround tests will be used on people by 2,000 members of the military working alongside the medical staff.
Well, Andrew Wilson joins us live now from Oxford. Hello, Andrew. So, Andrew, how will this scheme actually work in Liverpool?
Well, the government's certainly mobilising all the resources it can. It's got its hands on at least 4 different types of tests now. Most of these are lateral flow tests, as they're called. You don't need to go to a laboratory. They give you the result there and then on the ground, very similar to a pregnancy test. They've now got these manufactured up to speed, and they want to flood these into the city of Liverpool. 2,000 soldiers drafted in, about 30 centres they want to establish. Friday, perhaps going on into the weekend. By Monday, these centres should be established around universities, schools, other areas where people gather, places of work, and that people can then start getting tested. And what they're looking for, of course, are people who are asymptomatic, people who may be spreading the infection but not showing any symptoms of their own. That will mean people won't necessarily be constantly harassed by track and trace systems, but can be told if they're infectious, you alone can go home and isolate for 14 days or whatever the requirement will be, considering the infection that they find. The government advisors say this could be a game changer. Liverpool has become the unhappy epicentre for this second wave and a grim reflection of what the rest of England may see in the future. It's true that medical staff have experience now in handling the disease, but nonetheless the city's hospitals are filling up quickly and routine treatments are falling by the wayside. The government's plan to test the whole of Liverpool will be welcome.
So it will help us reduce the infection rates, the hospital admissions rates, and hopefully after the month lockdown, it'll enable us to come out of Tier 3 and move into Tier 2 or below that, which will help the Liverpool economy too.
Even as this mass testing rolls out, the entire country is bracing itself for a second lockdown. Not quite as complete as the first, but a blow nonetheless, with hospitality back on the front line.
We depend on hospitality for about 80% of our trade. And the other 20% is care homes, hospitals, schools. So this is a big body blow.
We're now planning ourselves to see how long we can last in this situation, how long till the money runs out. You know, hopefully we'll be able to last, and we believe probably till spring, till things will start to pick back up again.
The government has reinstated support measures. The furlough scheme has been extended, but thus far for 1 month only.
Before yesterday's announcement, the government had committed something in the order of £200 billion to support the economy over this year. Now, that is a staggering big number. It is really quite hard to just give an impression of how big that is, and that's much more than we spend on the whole of the National Health Service, for example, in any normal year. So additional amounts over the next, if it's just another month, will be a relatively small fraction of that. But again, if this is 2 or 3 or 4 months, it's going to push that number from 200 billion up into the 210, 220, 230 billion. These numbers are, in normal times, absolutely mind-blowing.
The famous Christmas lights in London's Oxford Street have started their annual glow, but in 2020 there's little festive cheer on offer. The government desperately wants to build in some kind of reprieve over the holiday period, a pause perhaps, but at the moment, at this stage on the curve, no one's taking any bets. Now, the government advisor may call this a game changer, but actually going and talking to the people of Liverpool, the results have been quite surprising. People are a lot of them less than enthusiastic into participating in these testing regimes, and that's partly because of the bad feeling that's been generated by the previous Tier 2 and Tier 3 lockdowns in Liverpool and Manchester and the rows with the mayors and so on, and also people fearful of being told that they're positive with coronavirus but they feel fine and therefore being told to go home, and they're worried about therefore not being able to go to their jobs and they might lose money. So there's issues of trust, and there's issues of supporting people if they do come up with a positive result from one of these coronavirus tests. And bear in mind also, they're encouraging people to do these tests not once but again and again throughout the month, because they want to keep building this picture of what's going on in the city of Liverpool so they can then take this to other parts of the country. People may be reluctant to expose themselves to such an examination in terms of these testings, because the relationship with Westminster has grown so much more flimsy in terms of trust in the last couple of weeks.
Andrew Wilson talked to us there from Oxford. Thank you very much, Andrew.
Well, let's talk a little bit more about the testing pilot scheme. Now, Bharat Pankania is a senior clinical lecturer at the University of Exeter, and he joins us now from Bath, here in the United Kingdom. Thanks for joining us. Why is testing a potentially powerful tool in getting on top of this virus?
Testing gives you an early idea if a person is infectious, and it allows you to remove them from circulation, and at the same time it allows you to remove people who may be contacts of that positive case also out of circulation. Having said that, there are issues with this mass testing. The issues of what do you do if it is falsely positive and falsely negative. So the falsely negative first, you may by mistake reassure somebody that they're okay when they were actually infected and infectious. On the other hand, if it is falsely positive, meaning they've got an old infection, but the test result shows positive, what do you do? What does that mean? Because a false positive doesn't necessarily mean you're infectious. And then your earlier report correctly addressed the issues of compliance. So when you do find a truly positive result, are you going to be able to contain them and say, you will stay at home, it is the law, it is an order, and then also find their contacts and also pull the contacts out of circulation? I understand the contacts will be fewer in number because we will be testing them regularly.
So there are many challenges then when it comes to mass testing. You're talking there about false positives and how you work out the results and what to do with them. The type of tests that are used are important, though, as well as the strategy. Talk us through it.
Yes, so these tests are what we would call RT-LAMP. What they do is, it is a rapid analysis method. We take your saliva rather than scraping the back of your throat or back of your nose, and we get a result either by a color change or an indicator that we've detected viral RNA. So those tests are very simple, they're easy to deploy, and they can be deployed very, very quickly. So it's good to know that they're out and about. The issue is, what do we do with regards to the test results?
You talk about those test results, though. So say you came up with the perfect tests. Well, you know, could it change the course of the virus on its own? Or, as you say, do there need to be stricter rules on isolating, on enforcing isolation, for example?
Indeed. So we've got the perfect tests. There are many of them now, and these rapid tests will, in a way, help. They will help, but provided we also support the people who need to be pulled out of circulation. So if you reassure people that when you are tested positive and we order you to stay at home, we will also pay your wages. That is a good way forward. Similarly, all the contacts of that case, we will pay your wages because we want you to be out of circulation. Then you get compliance. And of course, it has to be a stick and carrots, which is, if we are paying you to stay at home and you disobey, you will get fined. And that's a fair exchange, I feel.
A fair exchange, but an expensive one. Bharat Pankania, Senior Clinical Lecturer at Exeter University, thank you very much.